Assalamu alaikum, good afternoon, and Ramadan Kareem to all of you. I'm Dr. Asya Nabi, Assistant Medical Director and General Practitioner at Prime Health, with you from our official Facebook, YouTube, and LinkedIn. World Health Day is celebrated on the 7th of April every year. This year, it is all about achieving well-being. The month of Ramadan is an excellent opportunity to focus on bringing back a balanced and healthy lifestyle. Through fasting, we learn how to manage eating habits and improve self-discipline. Today's webinar aims to help you understand how to make more informed choices, minimize complication, and maximize the benefit of your fast. Let me introduce my first speaker on this webinar today.
Hello.
Good evening, good afternoon, Dr. Kumar. I think I'm also fasting. Let me introduce Dr. Kumar. Dr. Satendra Kumar Multani is a very well-known and reputed consultant, endocrinologist, having more than 18 years of experience in diagnosing and treating endocrine disorders. Dr. Kumar practices patient health education with a holistic approach well suited to all his patients. Dr. Kumar has advanced training in endocrinology at the University of Basel, Switzerland, and the Diabetic Endocrinology Center of Western New York. He has presented scientific papers at various international conferences and has been a guest speaker and chairman in various CME programs all over the UAE. Dr. Kumar is with Prime Health for more than 10 years. Welcome, Dr. Kumar, on the program.
Thank you, Dr. Asya.
I'll be introducing my second speaker on this webinar today. We have Dr. Sabah Khalid. Dr. Sabah is a specialist in family medicine and also a branch manager at Prime Medical Center Al Nahda, graduated from Dow University of Health Science, is a member of Royal College of Physicians UK, having over 15 years of experience in various healthcare facilities where she held key leadership positions, provides medical education, and built a busy primary care practice with excellent reputation where she provides effective, safe, and patient-centered medical care and health education. Dr. Sabah is with Prime for many years as well. Good afternoon, Dr. Sabah.
Good afternoon and Assalamu alaikum to all.
Salam and Ramadan Kareem as well. I'll begin with my webinar with Dr. Kumar. Also, I would like to tell all our viewers, if they have any question, they can write in the comment box so that our doctors can answer the same. Dr. Kumar, we'll begin with the basic thing, what this webinar is all about. What is actually the definition of fasting?
Oh, that's a very good question, Dr. Asya. And if you see, there is no worldwide clear definition of fasting. There are different types of fasting which are there. And currently what we follow is that anybody who is fasting for around 12 hours plus, we consider that he's doing fasting. Now it can be of different time, and but there's no universally accepted definition of fasting so far. But why did I tell you the figure of 12 hours? Because after 12 hours plus, the metabolism is switched from glucose-based to fatty acid-based. That's why.
Okay, Dr. Kumar, I would like to know, the current concept is about a lot of fasting. We are not only talking about religious fasting where we have, particular amount of time and all. Since our viewers are from different communities and different backgrounds, there is something called, now the trend is about intermittent fasting and a lot of things. We would like to know from you, is there any more different type of fasting people should experience? And most importantly, what is the safest people should do if they would like to go ahead with that?
Yes. There are many different types of fasting. And for example, there are like alternative fasting, or 5:2 fasting, we call it, Like 5 days you eat your normal meals and 2 days you fast, and your caloric restriction will be from 500 to 800 calories per day. Then there is alternative fasting. Like one day you will eat your normal meals, one day you will have a fasting, and you will have restricted caloric intake. And then the most important one is the time restricted fasting, you can say, or you will eat in a certain period of time. Like for example, 8 to 10 hours in a day, you will have a period of eating, and then 14 to 16 hours you will not eat anything. And this time, you can say, the time restricted eating type of fasting is scientifically proven, and we have data in favor of that, suggesting that this has the maximum benefit on metabolic parameters, as well as in it improves the cognitive function also. It prevents the development of chronic neurological disorders like Parkinson's and Alzheimer's also. So time restricted eating, a type of fasting where the person will be eating mostly for 8 to 10 hours, and the rest of the time he or she will be fasting. But it is most beneficial if it is matching to the circadian clock of the body. What does that mean? It means that the person should be eating in the daytime, and he or she should be fasting in the night time. And towards the evening, particularly, the intake of the carbs and the food should be reduced, and they should try to eat a little bit early in the night, so that they can have fasting of at least 12 to 16 hours overnight, matching to circadian rhythm, a circadian clock. And this has been shown to improve a lot of metabolic, cardiovascular, and neurological parameters. And this is currently scientifically proven and the most beneficial one, which we consider.
Thank you, Dr. Kumar. So when you talk about the benefits and health benefits of fasting, Dr. Sabah, what science says about fasting? Like if we really want to say out of the religion, is there any scientific ways? As Dr. Kumar already mentioned few of them, I would like all of our viewers to know the list of benefits of fasting.
Thank you so much, Dr. Asia, for giving me the opportunity to talk in this wonderful topic. Actually, it's a very fast thing, actually, and I think this time is very limited to talk about the benefits of fasting in a short period of time. So, starting from the very basic thing, which is in the fasting, is that it decreases your sugar levels and decreases the insulin resistance, which is the key factor for many metabolic process in the bodies. And because of this, what happened, your decrease of the overall caloric intake which reduce, then it helps in reduction of your weight. And then despite of weight reduction, the fat is the basic thing which actually reduce. It's not the skeletal muscle protein or anything which is going to reduce. So it is one of the best thing during the fastings. And especially if you will do the calorie restrictions, there is a more chance that there will be the muscle wasting. Then coming on to the inflammatory process of the body, there are many inflammations and pro-inflammatory markers, for example, interleukin-6, for example, C-reactive proteins or tumor necrotic factors. These are the inflammatory markers which produces the inflammations in the body. So it has been proven that it reduces the inflammatory markers in the body, and in turn, it helps in the prevention, or it deaccelerates the many chronic conditions, for example, rheumatoid arthritis, multiple sclerosis, and cancers. Coming to blood pressure, it is very common here. So there is any studies which has been done especially for the blood pressure. It was in 2019 in the Imperial College of the London and was published in the American journals, that it actually proven that it reduces the systolic blood pressure and diastolic blood pressure. And it actually, how it does is actually reduce the cardiac returns. It reduces the overload on the heart, and in turn it reduces blood pressure in the heart. Then coming to the cholesterol, again there was studies in 2016. It was conducted, and it shows that fasting actually reduces the LDL, which is the low density lipoprotein, and in LDL, especially the VLDL. that small the molecules which actually the cause of atherosclerosis or obstruction in the small blood vessels, it actually reduces it. And second, triglycerides, the level of triglycerides have been reduced to 35%, and level of LDL it reduced to 21%, is shown by the studies. Then coming on to the brain functions, it actually boosts the brain cognition, the memory, by improving one protein that is called BDNF, brain-derived neurotropic protein. Is a type of protein which actually increases during the fasting period. The studies conducted on it that after 48 hours of fasting, the BDNF increases up to 420%. You can imagine. And it actually, the degeneration of the nerve cells, these things improves, and in turn, the dementia, the Alzheimer's, all these diseases, the progression reduces, the chance of occurrence of these diseases reduces, and the cognition functions, it improves. Then coming to the next thing, which is actually the fasting causes the increase of growth hormone. What is actually the growth hormone? Growth hormone actually involves in our aging process. So the aging process get delayed. In turn, it actually increases your weight reduction. It helps in your protein muscles metabolism. So increase in the growth hormone, it one of the beneficial thing which is happening with us during the fasting times. And another GIT, if I will not mention, on the GIT system, it's actually U-turns our GI system. All the bad bacteria, all the bad toxins, it actually reduces from our gut, and we are towards more of the healthy side. Then cancers. Many research have been conducted on the cancer studies, and it clearly shows that it reduces or prevent many type of cancers. Why? Because 13 type of cancers are due to obesity. If obesity is reduced, of course, cancer is reduced. Then there is a special process in our body that is called like autophagosis, in which the cells eat the bad cells itself. So the tumor cells also reduces. Apoptosis, again, the same type of process. The DNA repairing system is activated. The antioxidant enzymes, this actually improves in your body. And there is one research which is actually shown the chemotherapeutic effect during the chemotherapy. The side effects of chemotherapy reduce, the effectiveness of the chemotherapy actually it improves. Again, the main basic things for the cancer things, the favorite thing is glucose. It needs glucose to grow. When glucose is reduced, of course, all the cascade of the inflammations, these things will be reduced. Okay, there are not many benefits.
Thank you, Dr. Sabah. I think if we start, adding the list is not going to end there. We are receiving a lot of appreciation and Ramadan Kareem messages all over from our patients and people who are, who are attending us currently. Dr. Kumar, very important, since we talk about a lot of benefits. Now, it's very important that who are the people who should actually go for fasting. If we want to differentiate into mild, moderate, or high risk, how do we do that? We have you are the master in letting us know how to go ahead with it, with keeping at least 3 of the major diseases, which is diabetes, hypertension, and high cholesterol, how they should approach, and if currently they are living with it, how and when they should actually go back to the primary physician while fasting.
Dr. Asia, you are referring this to a diabetic patient or the normal individuals?
Normal, doctor, we will start with the normal first, and then we'll carry on with the...
As I told you, the intermittent fasting or time-restricted feeding type of fasting can be practiced by most of the people because it is considered as a healthy adaptation. And this mainly switches the metabolism from glucose-based to fatty acids and ketone-based, which is good for heart, muscle, as well as liver, as well as brain. So if you follow this time-restricted feeding, unless you are on insulin or some medication where your regular eating is very, very important and you cannot afford to have long gaps, except in those situations, most of the people will be eligible for this type of fasting because it is easy to do. Like, for example, if I tell you that don't eat at night for 12 hours, 12 or 14 hours. So you can start your meal early in a day when you wake up, and then you can finish the meal early in the evening. And it is easy to follow 12 to 14 hours of fasting
Yes,
overnight,
yes,
which is
correct.
matching to circadian rhythm without causing much problem. But only if the person is on multiple doses of insulin, where the longer duration of fasting can lead to development of hypoglycemia, those patients should not be advised this. And patients, suppose they are on some kind of therapy and they are malnourished, or they are already like having some chronic illness, underlying chronic illness, where their timely eating is important, those patients should not be advised this. But by and large, I can tell you that majority of the patients, whether they are normal weight, overweight, or obese, they can do this type of time restricted feeding, and this will protect them from many illnesses, and this will actually slow down the aging process also, as Dr. Sabah has mentioned, the multiple benefits. And this will prevent the cognitive decline, this will maintain their memory, and they will be spared of this metabolic disorder, because this will take away the metabolic stress at the level of cell, or at the level of even you can say DNA. So majority of the patients are eligible, are able, to do this kind of time restricted feeding. Now, if suppose somebody wants to go, now in the important point I would like to mention here, that when you are advising somebody about time restricted feeding, suppose they have a window of eating for around 8 or 10 hours. Now, those 8 to 10 hours when they are eating, that's a very, very important time, and they should know what to eat.
Absolutely.
It does not mean that they will go and eat anything, any junk stuff, or the wrong kind of unhealthy food, because that is going to give them acute hyperglycemic stress, and which can itself lead to endothelial damage and can lead to cascade of damaging problems, or damaging things. So the eating, what they say, that when you are eating during that period of time, you must eat like Mediterranean diet, the diet which is rich in fiber, fruits, nuts, and low fat dairy product, and the lean meat or the white meat, and it should not be very high in carbs. So the quality of diet matters when the person is going to eat in that period of 8 to 10 hours. So I think it's a doable thing, and most of us can do it, provided that we just time ourselves. And then another thing which I would like to add, that if suppose they have a window of eating for 8 to 10 hours, then they should have the first meal should be the most important one whenever they start. The last meal towards the evening should be the lighter.
Should be the lighter. Absolutely. I think I have a question from Mr. Ragab. Similarly, what you have just said, please give some attention regarding correction of bad habits of breaking fast, iftar in our Arabic culture. Doctor, here, if you would like to add something to it.
Yes, it's a very good comment, actually, Mr. Raghav, because we have seen that in particularly during iftar, there is overindulgence in wrong kind of food items, and we always advise people that don't eat the whole iftar at one time. When you break the fast, break with 1 or 2 dates, some nuts, and some mixed fruits. And the milk is very good rather than juices and this fried and fatty items should be avoided. And after 45 minutes and after an hour, there should be a main meal, which should be again a balanced meal. So any kind of overindulgence should be avoided, and the selection of food should be correct, because then the whole purpose of fasting in Ramadan goes away if you overindulge and if you eat wrong kind of food and if you have a very large meal in the iftar. So because Ramadan fasting teaches the self-discipline and the self-control, that's a part of it. So and the first and the foremost thing is to show that when you are eating the iftar.
Absolutely. Dr. Sabah, when we talk about, what to eat in suhoor and what to eat in iftar, so how do we really observe a meaningful fasting in Ramadan without compromising on health?
Thank you so much, Dr. Asia. Yeah, it's very important actually. If we are fasting, how we can get the maximum benefits of the fasting. So I will start from the so that it will be a clear idea for all of the audience how to get the maximum benefits of the fasting. For example, if we will start from the sahur, always get up a little bit earlier than the time, like half an hour, 45 minutes at least from the food time. Why? Because a bit of regular, if we will do a light exercises or anything, a light exercises or anything, if we will do, what happens? Our cortisol level decreases and our growth hormone level increases. It is the way to prepare our body for the food. Okay, and the glucose level is going down. So once we start, main things, four things which you have to take care during the sahur time, it should be added in your diet. First of all is hydration. Hydrate yourself first. Second thing is fibers. Why fibers? Because it decreases the you can so the hunger pangs in you, or it is like a appetite suppressant to you. It reduces the toxins from the gut. Then fourth thing is that just add up some complex carbohydrates. Why complex carbohydrates? Because it will be remaining in your gut for a long period of time. Complex carbohydrates should be more on the plant base. For example, oatmeal, barley, these things you can add up in your diet. Second thing is vegetables and fruits. Always take care that it should be a low salt diet. And protein, as Dr. Kumar also mentioned, the protein, the lean meat and the fish and chicken, you can but make it like 6 to 8 ounces. A handful of nuts, it's a very good source. Okay, avoid smoking. Avoid any caffeine drinks, especially in the morning. Why? Because it will increase the thirst and it will be difficult for you throughout the day. Plenty of water you can have. Then another thing, the patients or the people who are more into the dieting program, they can have a very good choice for the avocados smoothies. Make sure that you don't have any GI upsets or anything which is you are restricted to any lactate or you are lactate intolerant. You have to take care of this. Egg is a very good source. It's a complete proteins. It contains vitamins, glutathione. Then coming on to the next levels, if you don't have the time before sahur the exercise, after 2 hours of sahur also, you can have some light exercises. But do not again dehydrate yourself. Do not do overexertion. You should not have a sunlight exposure because it can cause dehydration in you. Then coming into it, follow the regular routines. This is a very bad, I think, traditions going on in our day-to-day life, that we are staying up late at night and then we are eating the late night meals and all these things. These are actually not good for our health. Then coming on to the iftar times, the iftar timing, see, if in the sahur time, we should restrict to more low glycemic index. And the iftar time is that we need something instant energy. Then we can have something which should be high glycemic index. Same just like Dr. Kumar have added up to. We can have dates, we can have raisins, we can have banana, we can have figs. Subhanallah, again our sunnah to start with the dates. Wonderful thing. Okay. After that, take hydrate yourself. 30 minutes or so, just have a gap of it. Let your stomach be ready for the food. Go for the vegetables, more of the vegetable soup I will recommend. Then coming towards the fruits, more of the fruits which contains water content at high. Water content like watermelon, then cucumbers, so that you can hydrate yourself well. Whole meal grains is very good for you. Have these things, again, proteins in your diet. Again, in some patients who are feeling very lethargic or undernutrition, they can have their vitamin supplements also. But this is very important that don't binge out during the the eating periods, and do not break your fast with a big feast. Okay, be limited to, so that you can have the more and more benefits of the Ramadan you can take, or more benefits of fasting you can have.
Correct. I agree with that. Dr. Asia, we can't hear you. I think,
Yeah.
I think I was on still mute. Thank you, Dr. Sabah. I think it was complete encyclopedia of one full day. Now, it's very important for all audience to know that they can have some of it every day, not all of it every day. Please keep that in mind. And you can always consult your doctor and your dietitian to make sure that you have that particular, calories. It's very important, and not to eat all of what Dr. Sabah said every day, but yes, some portion of it. Dr. Kumar, very important because, chronic diseases and fasting. So we would really like to know people with certain health conditions, like, for example, we'll first take with diabetes, then high blood pressure, and then cholesterol, who should not fast?
Yeah, it's a very good question, Dr. Asya, particularly in diabetic patients. And most of the diabetic patients have hypertension and hyperlipidemia as associated comorbidities. Now, in diabetic patients, we do the risk stratification before Ramadan. Like, it is always recommended that all these patients should see their consulting doctor and dietitian 4 to 6 weeks before Ramadan starts. During that time, the risk stratification is done, and in that we see that what are the risk factors which can affect them during the fasting in Ramadan, and whether they're eligible to fast or not. Majority of the diabetic patients who are on oral medications and who do not have any serious comorbidity in form of chronic kidney disease or cardiac disease which is not settled, or recent stroke, they will be able to fast. And there are diabetic patients who are on single dose of basal insulin or once weekly GLP-1 receptor based therapies. They can still fast. Now, the majority of the patients will be able to fast with the proper pre-Ramadan assessment, education about hypoglycemia and other complications, and the adjustment in the diet and their medications. So it has been shown that if we do a proper pre-Ramadan education and assessment, and if we give them proper guidance, most of them will sail through Ramadan very easily. Now, in 20 to 30% of the diabetic patients who are on complex regimes of insulin, like 3 to 4 times insulin, who are type 1, having type 1 diabetes, or who are having chronic kidney disease, stage 3 plus, and who are having macrovascular disease in form of coronary artery disease with multiple stents, or coronary, they have undergone bypass surgery. They are dependent on caregiver. They have issues with the bad severe neuropathy or retinopathy, where they are not able to take care of themselves, and they are dependent on caregiver. Now, these people and people who have hypoglycemia unawareness, who have episodes of hypoglycemia and they were not able to recognize it, and they require third-party assistance, particularly in last 6 to 8 weeks. So these type of patients, actually, we advise them not to fast because they are in very high risk category, and actually that can, if they fast, there is a chance that they can suffer with some life-threatening hypoglycemia or any other complications, or if there is a history of diabetes ketoacidosis.
So I have a question here. When we talk about hypoglycemia, what do we really call hypoglycemia? If anybody else wants to know, what is hypoglycemia, and when do we say that it is? What are the symptoms related to it?
Hypoglycemia, in layman term, we call it as a low sugar. So we define low sugar if the level of blood glucose at any time is less than 70 mg/% on your glucometer, because that is the easiest thing to do. Most of our diabetic patients, they are having this device. So less than 70 milligram, if the value is, that means it is hypoglycemia. The fast should be terminated. The second thing is that more severe hypoglycemia is less than 54. And then a very severe hypoglycemia grade 3 means the patient is requiring third-party assistance because they are not able to take care of themselves. So these are the 3 grades of hypoglycemia. So less than 70 mg/% is the first indication to terminate the fast if suppose somebody is fasting in Ramadan. And we always tell the patients who are at high risk to monitor the sugar levels more frequently. And we encourage most of our diabetic patients to use the flash glucose monitoring if they can afford it, where they can check the sugar without pricking. And they can check several times of the day. Particularly this Ramadan time is the best time to use this flash glucose monitoring. And they will be able to assess what is happening throughout the day. And the first 1 week is very, very crucial in Ramadan because the metabolism is changing. And if they monitor more frequently, then they will be able to see what is happening. And they will be able to tell their healthcare provider also for regarding the adjustment of the dosage.
Since it's very important to talk about this, flash glucose monitoring, I would want you to speak little about it so that, most of the people know about it, doctor.
Yeah, so currently most commonly used flash glucose monitoring is available in the form of Freestyle Libre, which is a small coin shaped and size device which we fix it on the arm. And then there is a app for that which will be installed in your mobile, any mobile, Android or iOS or iPhone. And then without picking, but just showing the mobile near the device will show the glucose reading. Now, one thing which
Absolutely.
yeah, and this one sensor, it costs nearly 250 dirhams here, and it lasts for 14 days. So, if for Ramadan, most of the patients will require only two sensors, and
So for high risk patients or who are really keen to fast, can fast with this kind of setup. It will
yes,
be helpful for
yeah,
them.
moderate to high risk patients who are taking 2 or more doses of insulin. So this is a very helpful thing. And but one thing we have to remember that when they are using this sensor Freestyle Libre, this shows sometimes 15 to 20 milligram less in comparison to glucometer. So they have to just cross check in between with the glucometer that what is happening. So that is one thing which we have to remember about this flash glucose monitoring. But it's
So,
very yeah.
so doctor, just wanted to know, since there are nearly 14 hours fasting in UAE, and people generally check before, before opening their fast, they check their blood sugar. So, is it wise to go ahead with 14 hours of fasting and then expected that this is the correct reading for fasting, or how many hours should be for fasting?
See, in the monitoring, the importance of monitoring in Ramadan is of different kind. Here we are not seeing that whether fasting blood glucose level is this much or that much. What is our intention is to see that patient is not having the extremes of hyper and hypoglycemia. Ideally, it is recommended that any reading after 8 hours for the sugar is considered as fasting. So, if somebody has eaten the sahur at 4 o'clock and if he does the blood test after 12 o'clock, afternoon at 1 o'clock, that is considered as fasting actually. But for the lipids and all is not considered as fasting. Now, the intention of advising the self monitoring of blood glucose in Ramadan, that usually when the metabolism is changing due to fasting, there are certain periods when there is an increased risk of low sugar, and that is why we tell patients to monitor their sugar mainly in the morning, like at around 10 o'clock, then at 12 noon, then 2 o'clock, and then just before the iftar. Now, from 10 o'clock to 12 o'clock readings, you will come to know which way you are going. This will give you an indication that will you be able to sustain the fast till evening or not. Suppose at 10 o'clock in the morning, your fasting sugar, your random sugar comes at 80 milligram percent. Then there's more likelihood that it may go down towards evening and you need frequent monitoring. And suppose it is 120, 140 or 150 somewhere like that, there is a less likelihood that it will go down or it will go below normal. So the frequency of monitoring is important, and it is more important particularly if suppose somebody is on injectable medications or sulfonylureas which have potential to cause hypoglycemia. So and suppose somebody is controlled and they just want to see whether their control is good or not, we advise them before iftar and 2 hours after main meal of iftar, then before sahur and 2 hours after sahur. This is the minimum which is recommended in patients who are in the less risk category and all.
So, doctor, to summarize, who are the high risk who should not go for fasting?
Okay, the patients who are having type 1 diabetes and the type 2 diabetes patients who are on basal bolus regime or multiple doses of insulin, then patients who have macrovascular disease, any recent stroke or heart disease, underwent stent or bypass, then patient with chronic kidney disease, stage 3 plus, patient with hypoglycemia unawareness, where they're not able to recognize the episodes of hypoglycemia and becoming unconscious suddenly, and patients who are elderly and dependent on caregivers. And pregnant women should also be exempted. Yeah.
Also to be. Dr. Sabah, we have a question from Dr. Muhammad Zubair. What is your opinion about ketogenic diet in Ramadan while in suhoor or iftar?
Good question, actually. And I would like to elaborate a little bit what is actually process going on during the fasting in our. There are two type of main processes which is going on in our body during the fasting time. One is the gluconeogenesis. What happens when during the early 12 hours of fasting, our glucose and glucagon, whatever it in our body is there, it has been utilized in all 12 hours. After 12 hours, what happened? The fatty acids, the amino acids, the lactate, or visceral storage, all these has been converted into the glucose, because our body ultimately knows glucose. So these proteins, amino acids, and all these things will change into the glucose to be used as. So liver opens up, triglycerides, all these things will convert into it. So it's a stage of one. The second thing which process is going on is a stage of positive ketosis or healthy ketosis, in which again our ketone bodies and our amino acids is it utilized as a fuel. So the thing is, already there is a stage of ketosis, and some ketone bodies are formed in our body that actually suppresses our appetite also, our hunger episodes also, and it's a way of antioxidant. So we are already in a state of ketosis, healthy breakdown of fat is going on. So we don't need to go for extra ketone diet or anything. It's not recommended actually. You need to have a balanced diet. You should have carbohydrates, you should have proteins, you should have, so go for it, because it is a nature that is already going on. Your body is already into the stress of it, and healthy ketosis is going on.
Thank you, Dr. Dr. Sabah. Another question probably we can take from Mr. Raghav. When is the best time for exercise and fasting patient after suhoor, before iftar, after iftar? As many patients asking us this question.
Yes, one thing I have mentioned, if early in the morning before sahur, light exercise you can have, then after 2 hours of sahur you can have, and after 2 hours of again iftar you can have your light exercises. But again, it should be light exercises. You cannot go to any strenuous exercises which causing dehydration in you.
Thank you, Dr. Sabah. Dr. Kumar, we have a very interesting, I think, question here. If we eat high glycemic foods in iftar, they already know about it. We need to first explain what is high glycemic food for others to know. There will be chances of insulin resistance. So there's a lot of 2-3 questions in one question. So please answer this.
Yeah. Thank you, Dr. Mohammad Zubair, for asking this question. And yes, the high glycemic food are considered as bad if you take in excess. So as Dr. Sabah has mentioned, in iftar, you need some high glycemic food items like some melons and some dates in limited quantity. But if you overindulge in that, that will lead to a sharp rise in sugar levels, and that can disturb the whole metabolism. And particularly if you are taking juices or soft drinks during that time, or eating a lot of sugary sweet items, or the desserts which are very rich in refined carbs, then it can lead to a larger peak in glucose levels, and which can disturb the whole metabolism. And yes, it will increase the chances of development of insulin resistance. Many times you have seen that patients are getting diagnosed with diabetes during Ramadan because they are at risk. They are having some pre-diabetes which goes unnoticed before Ramadan, and when they start consuming these high glycemic food items, their diabetes gets diagnosed, and actually this pre-diabetes gets converted into diabetes.
Right, doctor. So I'll take some more questions. What happens if a diabetic doesn't? What happens if a diabetic does intermittent fasting?
Oh, they must do that because it has many benefits for diabetic patients. It not only improves the glucose sensitivity and reduces insulin resistance, it improves the fat metabolism also. And that's what I told you in the beginning, Dr. Asia. It is very easy for them to follow this time restricted feeding pattern. So they can eat for 10 hours from morning to evening, and they can fast for 14 hours. And during these 10 hours, the breakfast should be the best one. And towards the end of the day, the amount of carbs should be reduced. And towards evening, they should be having more high fiber food, more vegetable fruits and nuts and milk kind of stuff, So it's very easy. And we advise all our diabetic patients, if their work schedule permits, if they get up early, that, okay, you start your day early and finish your day early in terms of eating. And
Absolutely.
then 12 to 14 hours. And this has many, many benefits, as Dr. Sabah has already mentioned. The benefits are beyond the improvement in the insulin sensitivity and the sugar levels and the lipids. And it reverses the aging process. It reduces the oxidative stress-induced damage. And in diabetics, the most of the complications, they happen due to oxidative stress and metabolic stress. And that can be alleviated by doing this intermittent fasting, and during the feeding hours, choosing the balanced and quality-rich diet.
Absolutely. Many of the research also says that if you really want to increase your longevity, increase your aging, you should go for fasting, definitely. I think we have one more important question. Dr. Sabah, if you don't mind replying to this, what about the fibromyalgia patients who suffers in Ramadan? So probably patient is already having body pain, and Ramadan probably is increasing to this energy loss. So yeah.
Yes, actually, in fibromyalgia patients, yes, they suffer a lot because of their inflammation, their body aches, or all these things. They suffer a lot. But again, there is a good news in them. Then actually, fasting does reduces the inflammatory markers, as I have already mentioned, interleukin-6, tumor necrotic factors. And there is one another interesting things which is called AGE. What is AGE? Is advanced glycemic end products. Okay, what happens when protein breakdowns in our body and we are eating a lot of glucose, these proteins and glucose combine together and forms the AGE, advanced glycemic
In products.
so these end products are actually the biomarkers for the inflammations, for the agings, for the chronic disease like diabetes, atherosclerosis, atheromas formations, amyloid plaques, which is in Alzheimer's and dementia. So these are the basis of many diseases. So actually, and for patients' informations also, that the medicines which we are normally taking, for example, for cholesterol, like statins, for glucophage, yeah, vitamin C, yeah, aspirins, these are actually anti-AGE. These reduces these AG antibodies to improve our aging process and reduces the risk of inflammations. So, subhanallah, fasting is the best thing. This is actually, it reduces the AGs from your bodies. In turns, it reduces the inflammations from the body. So it actually helps in healing process. It helps in the healing process. Second thing, what happens, it is involved in your adaptation of your body. Your body learns how to cope up during the stress. Why? Antioxidants are increasing, oxidative stress is reducing, mitochondria is increasing. What are the mitochondria? For the layman, it's like an energy power. It produces the energies for us. So mitochondria is increasing, the energy is increasing. Second thing, our macrophages are increasing. What are the macrophages? These like a policeman for our body, which engulf the bacteria, the viruses, the parasites, all these things from the body. So it's a cleansing system for our body. It says actually reduces the toxin of the body. Again, second thing, microbiomes are increased. What are microbiomes? It's our friendly bacteria which fights for us. So all these benefits go for it, and especially for the autophagy mechanism, it's go towards more of xenophagy. Xenophagy is something which is different from the body. So it gulps it. It's like, it regulates the body mechanism towards a healthier pathway.
Thank you, Dr. Sabah, for that enlightening that my knowledge also. Very importantly, people should not say that fasting reduces the energy. It actually increases the energy. Saying so, Dr. Kumar, we have another question. What is the healthy way of fasting for children? Yes, very importantly, I also want to know that is it really recommended for children, and from what age, and what are the factors we should look for before we begin or we encourage children to fast?
Well, we don't have any scientific proof for that when should we start recommending them. But one thing I can tell you regarding this, that our children should not be overfed, and they should not be like particularly the children who are 10 years plus, and because brain development is happening in the age of up to age of 7 to 10. So during that time, always we should focus on the healthy and balanced diet for children, and they should not be overfed, in the sense that we should maintain a gap in them also between the two meals. And the best, if you want to do, use the same time restricted feeding, and try to have a gap of at least 10 to 12 hours in the night, because that is easiest to follow with the children. And they sleep also, the younger children, they sleep at least 8 to 10 hours. So that will be the best. And the time during which they are eating, you should focus on the quality of the food stuff, and you should not force them to eat more. And then develop the habits of in terms of, don't give them too much of carbs in each meal. Each meal should be balanced for children. It should have everything like vegetables, lentils, a protein source, and then salads, and low fat dairies. So the children, they need a balanced meal in each time because of their growth. And many times you are seeing that the most of the children, they are being served more of carbohydrate in each meal. So then the quality of the meal gets affected, and then they do not eat the other accompaniments which are very much required. So time restricted feeding can be practiced in the elder children, 10 years plus. In children who are in adolescent stage and who have family history of diabetes and all, because a lot of young females, young children, they are developing symptoms of PCOS also in early stage, like after menarche, like in 14, 15 years. Those children, they should be taught about time restricted feeding, and there you can practice 12 to 14 hours of fasting, particularly overnight, because children are going to school also. So sometimes it's very difficult for parents to enforce that. So best is to develop to maintain good quality of the diet, balanced diet, and avoid overfeeding. And as per the need, they should be given.
So best is to feed them early, early to bed, early to rise, and feed them early with less carbs, and overnight fasting should be started with, so that they get in habit of that.
Adolescent children who are on like grade 9, grade to grade 12, where they have to study till late, we have to tell them that whatever you want to eat, finish it off before 10 o'clock. This midnight eating and being awake, it completely disturbs the circadian rhythm. It's one of the important cause of rising prevalence of obesity. And because then what happens when you are awake till late night, early morning, then you keep eating or munching. That is not good for metabolic health, in general, not good for health.
Absolutely, Mr. Samad is asking, hello, good afternoon. My wife is 3 months pregnant and is fasting. Will it affect her pregnancy?
Yes, thank you, Mr. Samad, for asking this. Actually, fasting is not for pregnant. Fasting is not for lactating mothers. They can have option. They can fast later in their life, because one life is associated with them. So they have to take care of it. And if a religious point of view is signed, it's not recommended. They have an option. They should go once pregnancy is over, once lactation is over, they can get for it, because there are a risk of many malnutrition, many deficiencies, which we cannot predict ahead before. So better do not fast during pregnancy and during the mother feeding. We have an option for it. Go and avail it.
Yes. Dr. Asiya, you are muted.
Sorry, and thank you, Dr. Kumar, for letting me know that. Dr. Sabah, I would like to know that during this Ramadan or previous Ramadans, what are the kind of complaints patient comes to OPD with? What are the most common health concerns during Ramadan while people are on fasting? What do you see, and what is your advice on those most common signs and symptoms?
Dr. Asiya, in our OPDs, patients are coming with the complaints of normal headaches, dizziness, lethargy, clumsiness, and exhaustion, muscular cramps. These general complaints are more. Again, I will go back to their diet regimes are not good. We are already we are explaining to them that what they have to improve their diet. They are not following a proper routine. They are not sleeping early. They are not getting the adequate sleep of 7 hours. Then hydration status is not good. Late night food, late night sleeping. All these are factors for these headaches. Especially the dehydration can cause the headaches. Electrolyte imbalance is one of the cause for this. They should go for the more of they can have the multivitamins along with it. More fruits, vegetable diets, fresh salads, all these things. Fatty diets and high glycemic diets, they should to cut it off. So that the thing is their light exercises also they should add up, so that what happens, this metabolism of the body will come into inaction. The second complaint is gastritis, gastroenteritis. Again, we are breaking the fast with the feast. I think they should cut it down. And proper eating, small, frequent meals. Do not put a lot of exertion on your body, because gut is also changing. Their metabolism is changing. So do not stress yourself towards go towards more healthier side of eating. You can have probiotics along with it. Ulcers patient, they should, I think, consult their doctor first if they can, or they cannot fast. If it is difficult for them, they can withhold the fasting. Then second thing, cigarette smoking. Smokers, withdrawal symptoms are there when they are not getting the cigarettes. Of course, they will come with the headaches. Then dryness of the eyes. This is very one of the most important complaints are there. Again, dehydration is one of the cause for the dryness of the eyes. Then patients are, especially our females are. I think that is one of the platform I would like to add up with females. Females are coming and asking for the some medication to delay their period so that they can have full fasting or full Ramadan. It's not recommended at all. They don't have to go with their normal physiology of the body. And even religious point of view, it's not permissible. You are allowed to fast, and you are not allowed to fast during these timings. So get the benefit of it. You don't have to take any type of hormonal pills to delay your periods. This is what wrong practice is going on this. Other than that, some patients, which I will recommend also, as Dr. Kumar said, they are not going to their physicians ahead before Ramadan. They are not prepared or fit. And plus what happened, their diabetes or their hypertension, a bit of uncontrolled side. Then at that time, you have to put in the efforts to put all the things on the track. So these are the basic complaints which we normally encounter during the OPDs.
Absolutely. Thank you, Dr. Sabah. As usual, very elaborative. So headache is because of food concerns and less sleep. Your gastric issues are there. Your eye issues are there, but don't think that it is only because of Ramadan issues. It can be otherwise as well. So the best practice is always to seek opinion from the doctors. We are living in a country where everything is available. So please do check whenever you have issues. So Dr. Kumar, as we're proceeding towards end of the session, how we can use this Ramadan period, because it's a long 30 days period, already 6-7 days are over, to ensure an overall health and well-being. How do we achieve?
Yes, Ramadan is actually a good opportunity to learn self-discipline. So people who can practice a good self-discipline of eating, sleeping, exercise, hydration, I think for them Ramadan is very easy to follow. Now, people who want to go to extremes, not sleeping in the night, overindulgence in the food, and not following any discipline, that will put them in trouble actually. So I can tell you in one word that if you can follow a good self-discipline, Ramadan is very easy. Whether it's taking medication, whether it's eating food, whether it's rest, anything, a simple self-discipline can solve most of the problems.
Thank you, Doctor. I think self-discipline is what we all need to know. Dr. Sabah, do's and don'ts in Ramadan.
Yeah, as we have explained before also that this one, what you have to do it, check out your hydration status, do regular exercises, sleep on time, eat on time, Quit smoking. This is a best time to quit the smoking if you can do it. Avoid any caffeine drinks. Avoid any salty foods. Strict towards your healthy regimes of the diets. Then coming, if any health problem is there, seek your health provider first. If you can continue with the fasting or no, you have to cut down. And if you feel that there is any problem with it, your metabolism is not working well, or it is not suiting you, or you are getting into trouble, so do not continue it without the advice of a medical healthcare provider. Then again, if we will see it that what we are doing normally is that we are more into the activities which are towards the eating habits. So what we need to change is our eating habits. We have to stress more on it so that we can get the maximum benefits from it.
Thank you, Dr. Sabah. Dr. Kumar, Mohammad Rais Khan is asking which diabetic patient should avoid fasting. I think you have answered, but I would like you to repeat it.
I'll summarize it once again. So diabetic patients who are not at all controlled, diabetic patients who are on multiple doses of insulin, whether it's type 1 diabetes with multiple doses of insulin, or type 2 diabetes, with diabetic patients with recent history of cardiac problem, and they have undergone any procedure like bypass surgery or stenting. The cardiac disease is not stable, and diabetic patient with chronic kidney disease, stage 3+, and diabetic patient with hypoglycemia unawareness, who are not able to sense hypoglycemia and maybe getting unconscious without realizing it's hypoglycemia. And diabetic patients who are very elderly and who are dependent on caregiver, they should avoid fasting.
Thank you, Doctor. Dr. Sabah, what is the most common myth you have heard about fasting and people should not really believe it?
Number one is that fasting puts your body in starvation. No, it will not. It will actually utilize your deposits, your fats, your triglycerides, your lactate. All the toxin have been utilized. Again, the AG which I told you, these amino acids when breakdowns, again it will be reutilized by the body. And what happens? Your dependency on the protein will be reduced itself. Second myth is it increases your stress level. No, it doesn't increase. Yeah, for time being, a bit of epinephrine and stress hormones, the fight and flight hormones a bit increase, but this is again beneficial to you. Why? It's just setting up your body to combat any type of stresses in the body. Your body will learn. It's the same like for the muscles. If you will we will start exercising, the muscles will grow stronger. It is the same thing which we are keeping into the practice. Then third myth is it's difficult for us to focus during the Ramadan. No, actually, it actually improves the cognitive function, the memory. It reduces depression, anxiety, our memory, and our learning patterns will become more faster. Again, by increasing the levels of BDNF in our body, which helps to regenerate the nerve cells. Third thing, which normally it says that it reduces our immunity. No, it actually increases our immunity by decreasing the stress level, increase the antioxidant levels, increase the macrophages, increase the mitochondrial energy powerhouse, and all these things in turn increases our immunity levels.
Thank you, Dr. Sabah. Dr. Kumar, about weight loss. Generally, people think that, when they begin with Ramadan, irrespective of the age, in fact, age is very important concern. They lose a lot of weight during this Ramadan. How healthy is this weight loss, and to what extent we should not consult the doctor if there is too much weight loss in the Ramadan?
Dr. Sia, in my personal experience, I haven't seen many people losing much weight. So okay. I'm very happy because when they lose at least 3 to 5 kg of weight during Ramadan, I tell them that you had a successful fasting actually. Because we differentiate patients in two categories. Suppose somebody has gained weight, that means he has overindulged during Ramadan. Suppose somebody has lost weight, that means he really fasted and he did the correct thing. But if suppose somebody loses unusual weight, like more than 5% of their body weight and without much restriction. And that means they have to see their healthcare provider to rule out that they have not developed any hyperthyroidism or thyrotoxicosis during that process, or they have not developed some like they have not developed diabetes during this process, because that can lead to quick weight loss. So,
thank you, doctor, for that. My question is also, if people in old age, probably 70 or 80s, if we see weight loss there as well, is there a concern?
If 3 to 5 kg is acceptable, because in this age group, actually appetite is in general less. So mostly what happens that these patients, when they are eating in iftar, they are not that hungry in sahur. So they will keep will take a very small portion of sahur. So the appetite already is down in that age, and in Ramadan actually it further goes down. So mostly they will be having one meal which is more adequate, and the other meal maybe just maybe compromise. But if they feel that it is unusual in terms of that the previous Ramadans, they did not lose that much of weight, that is an alarming thing. Because always the previous Ramadan experience matters a lot in any patient who is doing fasting. Because they know what happens to their body during fasting. And if they find that something unusual has happened during this fasting, they must seek help.
Thank you, doctor. What are the fruits to be avoided during iftar time, Dr. Kumar?
Okay, I can tell you, a mindful eating will allow you to eat all the fruits. A mindful eating means if you start iftar with mixed fruits, whether it's 3-4 pieces of mango or 5 pieces of melons, you are allowed to eat everything. But if you are having iftar and immediately after that you are having a big meal, then better you avoid the fruits like melons and which are very high in glycemic index, and mango and banana and all. But if you are starting with fruits and nuts and dates, you can have mixed fruits. All the fruits you can eat in limit. There's no problem.
Absolutely. Dear viewers, please don't confuse yourself with healthy food, and please be very mindful about eating. You cannot eat too much of healthy food as well. It's something, calories, which we also have to be counted, and we have to be really mindful when we are eating our suhoor and iftars, as our doctors have given all the information about it. And now, since we are already going to end the session, Dr. Kumar, I would like to take important words, take-home message from you.
Okay, in my opinion, intermittent fasting with time restricted feeding is very, very helpful. It is proven scientifically. And eat mindfully during that period of time when you are eating. And Ramadan is a good time to reset and reboot your metabolism and learn self-discipline, which can help you later on also if you're not practicing before Ramadan. And if you follow the self-discipline, Ramadan fasting is very easy to do, and except in some patients where it is they should not be doing it because of their very high risk. So,
Thank you, doctor.
It's a discipline which matters everywhere.
Absolutely. Ramadan is all about discipline, learning techniques, learning things, and getting benefit out of it. Dr. Sabah.
Yes, Ramadan is actually a special time for the reflection, again, self-improvement, discipline, okay, how we will take care of our body. It's actually a maintaining process, the hauling system, the maintenance system. So get rest to your body and reset your body to a next new year with all the new powers and the new energy and a change status of your body.
So thank you, speakers. It was lovely to have the discussion. I have learned a lot. I hope all our viewers have also learned a lot. The month of Ramadan is an excellent opportunity to focus on bringing back a balanced and healthy lifestyle. Through fasting, you can always learn how to manage eating habits and improve self-discipline. We have discussed everything from suhoor to iftar. Please take care of yourself and see you soon in our next upcoming webinar. Thank you. Stay healthy. Stay safe.
Thank you, everybody.
Thank you.